Hello guys, welcome back. It's Unit 1 Part B. ICD, International Statistical Classification of Disease, which is done by WHO, World Health Organization. This World Health Organization has been classified disease in a section wise, in a chapter wise, to reduce the burden for the health workers. For example, these are divided in the chapter wise. Like chapter 6 is dedicated to neurological problem, chapter 7 is dedicated to eye problem, chapter 8 is related to ears, like that. Each chapter is related to each system. For example, in future, if we are discovering any kind of new disease or any kind of new cure to any problem, then that will be inserted in the respective systems. For example, very recently the COVID-19 has been occurred, which is not found earlierly. So this COVID-19, what is COVID-19, how the COVID-19 should be diagnosed, what is the COVID-19 prevention symptoms, what is the COVID-19's treatment, everything will be inserted in the chapter 10, that is the respiratory system. In that COVID-19 will be inserted. This is ICD, and it is nothing but it is a standardized way, it is a classified way where we will see things related to health system, like any kind of health problems, any kind of death causing conditions, any kind of regional problems or pandemic problems, or anything that is related to health systems will be classified, and how to manage these things will be classified and will be portrayed in a chapter wise, that is International Statistical Classification of Disease. Standard of care. Standard of care is nothing but the effective way to provide the care. This standard of care consists of assessment. I can't write here, it takes time. Assessment, nursing goal, implementation, planning, evaluation. Do you remember where you have been heard these words? This is nothing but the care plan. So by using care plan, we will plan how to provide care to the patient, in which way we need to provide care to the patients, like providing knowledge to them and providing medication to them in a correct way, and maintaining the personal hygiene, motivating patient, providing psychological support, explaining the procedure to patient as well as the family members, everything. This is the standard of care, and in this standard of care, the role which the nurse should be performed, the responsibility of the nurse will be given to her. Level of nursing care. These are the level of nursing care. While this is not even the first one, it is 0.5 level. That is, before first level we have earlier intervention. This earlier intervention is nothing but before a patient gets ill, we are trying to protect them. Outpatient treatment, this is level 1, and do remember, it is just for knowledge purpose. Knowing it briefly, it's enough. Outpatient treatment is nothing but OPD. When the person is ill, they come to hospital and they visit the doctor, and they don't get admitted in the hospital, just one day treatment, that is outpatient treatment. And second level is intensive outpatient treatment and partial hospitalization. Generally, in some conditions, the patient should consume medications like injections and IV fluids for 2 to 3 days. If they are not ready to get hospitalized and ready to stay in the hospital for 3 to 4 days, they can go to house and come to hospital when at the time of injection. That is second level. And third level, if you see, this is hospitalizing, that in some conditions patient has to stay in hospital, like starting from 3 to week around, or even around months. That is third level. And fourth is very important, this is in an emergency condition, like the patient is really in a critical condition, maybe the patient is kept in some kind of ICUs. At this condition, the effective treatment should be provided, and it is the topmost level of caring, that is level 4. ICU. ICU comes under the fourth level of care, the highest level of care, where the patient will be placed in an isolated ward, where the patient will be monitored by the specially trained nurse, specially trained staff. This staff will be specially trained for these conditions, so that in any kind of emergency situations, they will be not waiting for the doctor's order. They will perform on their own, like providing the oxygen mask or providing the CPR, like that. And in this condition, The treatment and care provided to the patient will be 24 into 7. Generally all the treatments are 24 into 7, but here the monitoring the patient is very specifically performed, so that if any kind of change, like any minor change in the monitoring, like increase in the pulse or increase in the heartbeat or decreasing in the heartbeat, will be immediately informed to the doctor, and further steps will be taken. Now the types of ICU, there are various types of ICU. Here I am going to show few types, like VICU, where the burn patients, the patient one who have undergone the burn injuries, they will be placed here. And CVICU, here the heart related problem patients will be placed, like heart attack or myocardial infarction, like that condition patients will be placed here. And next we have MICU, this is medical condition, general medical conditions, any kind of kidney problems, or if there is a sudden fall of glucose in that conditions, or sudden any condition like any kind of minor surgeries, general conditions, ICU will be placed here. And NICU is neonatal baby is nothing but from the birth to till 21 days, like 1 month baby, newborn baby, around 1 month baby, that is neonate baby. And for that baby, if there is any problem like jaundice or any other severe conditions, they will be placed in NICU. And PICU, this is pediatric intensive care, this is above neonate, like apart from 1 month babies, other baby till 2 years will be placed here. SICU, that is surgical intensive care unit, here the surgical patients, one who is undergoing the surgery as well as one who have undergone the surgery, will be placed here. Functions of ICU, here I have few points. Generally when you hear the ICU, you will get to know here we will be observing the patient very closely, like 24 into 7. If there is any minor change in the breathing pattern or pulse rate, we will suddenly inform the doctor and we will take further steps. If there is any absence of doctor, then the head staff nurse will take further steps to make sure the patient is alright. And for special treatment, for example, if the patient is requiring lots of machinery things around him, like oxygen mask or pulse oximetry and echography, he can't be placed in the general ward and he needs some privacy. So to isolate him, he will be placed in the ICU. And to find out the staff efficiency, to find out the capacity of the person working efficiency, to find out what level they can hold their responsibilities, to find their capacity, this ICU position is provided. Next, care for a post surgical operation, like after the operation the patient will be placed in the ICU. The main aim is to reduce the infection rate and cure it fastly. Next, to provide care for medical emergencies, yeah, it's very important. Generally cardiac emergency, cardiovascular emergency is generally seen, like heart attack patients or any kind of surgical patients generally related to heart is commonly seen nowadays. And apart from this, to provide support for any kind of critically ill patients will be placed in the ICU. Role of nurse. In ICU ward, the nurse role is very specific. They need to perform it in very effective way. Very firstly, we need to support the patient. See, whenever a person is coming to the ICU ward, generally they will never be happy. They will be very much in a frightened mood. So to make them calm, to make them comfortable, we need to provide them a psychological support. We need to educate them how the procedure is going to be, so that they will be okay. And next, we need to help the patient in whatever the way we can help them, in whatever the way it is possible, we need to help them. However, either it is verbally or either it is manually. And continuous monitoring will be performed and the nurse need to perform it in an effective way. Any minor changes need to be informed to the superior doctors. And effective individual care is nothing but 1:1 ratio. For one patient, one staff will be present and they need to perform their function properly. Counseling the patient's family. We need to inform all the information to the family. We need to take their sign. We need to follow few procedures before getting admitted the patient into the ICU ward. And we need to record all the activities, either increase or decrease or normal flow of heart rate, anything, any activities, we need to keep in count. We need to record it, particularly every hour we need to take it and note it down. This is generally followed in every way, that is nothing but the infection control. Hospitals everywhere they follow it. The nosocomial infection is very harmful, like When a patient is already coming with some kind of disease or some kind of health issue, and after coming they are getting another 1+1 offer, infection is not a good one. So every hospitals do follow the hygiene level policies to reduce the infection, and in ICU it's very much important. And keeping update with advanced information is nothing but the recovery level of the patient, how the patient is recovering, whether the medicine is working for him or not, whether the treatment is working for him or not. That is the information that need to be recorded by the staff nurse, and that need to be informed to the superior doctors